I'm Dr. Susan Colby-Allen, and I did a research article with Charles Blum that we did on Sacro Occipital technique and autism spectrum disorder, a case report. We did a series of 5 patients. They were not cherry-picked. I'm a part-time practitioner. I have a zeal for autism just because it is exponentially on the rise. And how many of you know an autistic patient or work on any of them? You're going to start seeing a whole lot more. So I developed just what worked for me. The cost of raising an autistic child is ridiculous. And not only is it a financial burden, but we also have to worry about the emotional burden, the family burden. It's these parents and families eat, breathe, and sleep autism. The parents are probably the most educated patients you'll get in there. I think one of the worst problems of autism is the self-injurious behaviors of hurting themselves or hurting siblings or parents. So this is something that just reducing this is huge, in my opinion. And I will say that I haven't cured anyone yet, but every single one of my patients has gotten a lowered ATEC test, which is an autism treatment evaluation checklist. So it's something that we can do, and then we can add more things with it to improve. So the purpose of the paper was to explore how SOT can recover autism. And then I want to help teach other doctors what I do so you guys can go out and expand it and make it better, because the autism rise is supposed to be 1 out of 2 by 2025. So unless we do something to help now, it's going to be ridiculous. And then there's a lot of other additional complementary protocols that go with what I do, what we do. And I think SOT is, well, I love SOT, so that's why I think it works best. But because we do the cranial adjusting and the CMRT, and then the spinal neuromusculoskeletal imbalance stuff. But with autism, there's inflammation in the brain. The gut is a mess. So if we're doing the cranial adjusting and the CMRT, you get a pretty good result from that. The protocol took me about 4 years, and it was hit and miss as to what to do. But what I have felt with every single one of them is that they have corpus callosum tension. So I developed the thing I found that works best is to do cranial first. And it seems kind of weird if you think about how autistic patients are, because most of them don't want their head touched at all. But if you get in and just very softly start with the parietals and talk to them, maybe start breathing in sync with them, and you might be chasing them around the office to do it, and you have to move quickly. So in the beginning, it's a pain. But as you work on them more and more, they get to where they know that you're helping them, and they'll sit still, and then the parents start loving you, and life goes on. My one that I picked out to go over today, this was a 19-year-old boy. He had a lot of problems growing up, and you can see how bad his kyphosis is in the anterior head carriage. He was pretty zoned out when I met him. He had constipation his entire life, and that's something you will see with autism is they almost always have constipation or diarrhea. Their gut issue is huge. They don't detoxify well. And this patient, although he had a hat on that day, so there's the hairline, but his frontal is so sloped on this that you could feel a huge ridge, and I started working on him. So by January, he was already standing up straighter, as you can see. And he also had a lot of scoliosis. Interestingly, his dad is an orthopedic surgeon, so he was kind of amazed by what I could do. I started doing an Area 1 spread, which actually isn't what I'm going to teach this afternoon, but that's what he needed. And that was on the very first day. And there's the other things I did, the CMRT of colon, stomach, diaphragm. And I know usually with SOT we just do one organ of CMRT, but on this group of patients, I believe we need to do whatever they need to have done. And this boy always needs colon reflexes. But after the very first adjustment, he had a bowel movement on his own, and his mom was thrilled. 19 years old, the kid never crapped, so she was happy. And he also put his toys back on his bookshelf, which he had never, ever done from one adjustment. I've seen him a lot now. But the other thing that you really want to do is get the patients off of gluten, soy, and casein. So there's more on how he did over time. His eye contact is really improved. When he walks into the office now, he looks at me. They've actually moved out of town and they come back and forth. But he speaks with his own made-up sign language. And after I started working on him, he had an iPad that he could then start using and telling his parents what he wanted to do. So he's way more conversant and more social. I mean, he's not healed yet, but he's getting there. His kyphosis and scoliosis have reduced a lot, and he'll ask to get adjusted. His beginning ATEC was 71, and his ATEC, I don't remember what date it was at the beginning, but the ATEC dropped to 45, which is almost half. So they were very pleased with that. And all that was changed with that was me, the chiropractic care. So he started also like doing dishes and chores around the house and becoming just more and more, a little bit more neurotypical each time. He had an EEG done, and the neurologist said, whatever you're doing, keep doing it because it's improved. It's not normal yet, but it's better. And you can see, I mean, he's kind of zoned out looking here, a little bit better January, but by April, he's got more color. His face certainly has changed in shape. And if you remember the kyphosis and the anterior head carriage, which he still has, but he's so much more straight, and he's also checking out the spine. So he's interacting. And this is like every single one of my patients has had some kind of improvement. So I had to write the paper. Now, there's once in a while things that work and complement. There's several different things. This particular protocol I wanted to include because I think as chiropractors we need to know, and whether it's autism or anything else, this book was brought to me from the patient data group. The parents, they go out and research everything. And it made such a huge difference that I included it. The protocol used by Carrie Rivera is really, it starts with the diet. These kids have to be off gluten, soy, and dairy. And the diet in the beginning is a pain, but that makes a huge change in them. And then there's other steps that she does, including chlorine dioxide and a parasite protocol. And supplements, chelation, hyperbaric chamber, which is a hard chamber, not soft chamber, GC-MAF, and she has recovered 217, I believe, children as of last week. So again, the no gluten, dairy, soy, that's huge with these kids because their gut is just a mess. And the gut-brain barrier connection is so huge with them. CD, I don't know if anybody in here knows what it is, but it's a really mild detoxifier. It's less harmful on the tissue than ozone. So it's easier on the body than ozone. It kills pathogens, but it doesn't kill the cells. And I researched about 100 hours to make sure this stuff was safe. The parasite protocol is part of the book. These kids, because of the gut being so bad, they're more easily infested with parasites. So that's kind of that's something you can choose to do or not to do, but certainly if you can stay and learn what I teach with the SOT part, we're going to be able to help a lot of kids. So the patients, every single one of them got better, batting 100% or 300, whatever. That's not bad. I mean, it's only 5 kids, but... And then this is 2 of them at the school. They have an autism school there. And even then, that boy's, I mean, he's just so much standing up better. And I know that a lot of you probably have other great ideas we could add. I think we need to collaborate. I really, really have a passion for this because autism is taking over the world and we need to really get a hold of it. Thank you.